The thing I want to talk about this week is helping you complete that plan of care for that patient. Because again, it's not about you unethically getting that patient back for their sessions. You ultimately have a duty of care to help that person get the best possible result. Okay, and the best chance we have is building resilience, which unfortunately happens usually the steps after that person's pain-free. So for a lot of people, they don't see the value in coming back in once that pain has been eliminated. Okay, so ideally after the pain's been eliminated, that session after, the session or two after that, that's an opportunity to build resilience. So the tip that I've got for you this week is to always justify why that patient's coming back in next week. So that might look like something like, okay, Betsy, I'm going to see you. I need to see you next week, because once you've got this done, then we can move on to the hopping, which if we can do the hopping, then obviously that's going to get us that step closer then to getting you back to the running. Okay, so what patients don't like doing is being felt like they're not getting value, okay, or like someone's just trying to take their money for the sake of it. Whereas if you have a genuine ethical reason to get that person back in next week, I can't help but feeling you're almost doing them a misservice by not getting them back in. Okay, so that person's come to you for help to get them back to that ideal outcome. Okay, and it's very, very awkward. Sometimes we feel bad as therapists saying, oh, I'm going to need to see you next week again. Okay, whereas actually that person has come to you. You are the guide. Okay, that person's the hero. You have to guide that person. That person's looking for guidance. They don't know what to expect. Okay, so it's up to us to educate them and guide them on the best course of action. Okay, now the one thing you don't want to be doing is bringing that person back in again and just doing the same treatment over and over again. If you are bringing that person back in and they're lying on the bed for half an hour, 45 minutes, they're doing the same exercises and they're not making significant step closer to their ideal outcome, then with the greatest respect, but I would suggest that you are lost. Okay, every single session needs to build upon the last session. Every single session should be progressing through that ideal graded exposure to get them back to that ideal outcome, whatever that is for that patient. In the ideal scenario, now sometimes we do have to repeat some stuff. We do have to spend a week or two using the same exercises, but ultimately what should happen is it should be building session upon session. Okay, and if you have got that structure in place, so that every session is just the next natural progression, you've got that graded exposure bang on, then that will be very, very easy to understand. It'll be very easy to justify to your patient. And most importantly, you have got the confidence and clarity with the plan on what is happening on every single session. And that's very, very powerful from both a clinical point of view to help that patient keep progressing. And then also from a financial point of view and building your practice, in that you're not getting the person to drop off, you're getting the ideal outcome, you're getting a raving fan, a happy patient who's going to continue to spread the word about your clinic and ultimately allow you to grow that go-to physio. Go see John, go see Amy, go see Mary. She helped me get back to doing X, Y, or Z, and the pain hasn't come back. The biggest frustration for me, okay, and I really emphasize it a lot with my own therapist, is the last thing I want is somebody who said, oh, what do you think of post-op physio? They were good initially, but then the pain came back again. Okay, I would hate to think anybody is saying that. And there has been cases where people have dropped off once, obviously the pain's gone, maybe they shouldn't have been dropped off. And again, we reflect on that on our weekly CPD training session, and we try our best in every facet of the system to continually improve. Okay, and ultimately that's not going to go down to a physiotherapy skill, that's going to go down to a communication skill.